Chapter 33, Challenges for the Future. Mental disorders and illnesses rank high among the illnesses and conditions that cause disability in the United States, Canada, and Western Europe. Historically, most psychiatric care was limited to an inpatient setting. In society today, most psychiatric long-term care institutions are closed. Those that still remain are full. Local emergency department and jails are becoming institutions for those experiencing mental crisis. When the large state mental health institutions began discharging their clients, it was argued that most people could live in the community if they continued to receive medication and aftercare. Many mentally ill persons were transferred to nursing homes and long-term care facilities. Homelessness results from a complex set of circumstances that require individuals to choose between food, shelter, and other basic needs. Only a conscious effort to ensure jobs that pay a living wage, adequately support those who cannot work, affordable housing, and access to health care will bring an end to homelessness. One of society's greatest challenges today is homelessness. Many families live one paycheck away from poverty. They can financially cope for the present, but if one stressor is added, and the whole situation then becomes threatened. It is estimated that the financial cost of substance abuse and addiction in the United States totals $742 billion per year. For illegal drugs, the cost is $193 billion per year. For alcohol, it is $249 billion per year. And for tobacco, it is $300 billion per year, for a total of $742 billion a year. An individual with a disability is an individual who has a physical or mental impairment that substantially limits one or more major life activities. They have a record of such an impairment, and they are regarded as having such an impairment. Employers are not permitted to ask job applicants about existence, nature, or sensitivity of a disability. Applicants may be asked about their ability to perform specific job functions. A job offer may be conditioned on the results of a medical exam, but only if the exam is required for all the entering employees in a similar position. Some problems may be specifically limited to members of certain groups. These are called culture-bound disorders because they appear to be related to specific cultures. The mental health care team consists of a psychiatrist, psychologist, the individual, a doctor, the nurse, social worker, could be a priest or a spiritual caregiver, the dietitian, any specialists that are needed, as well as the family. Mental health care team members communicate frequently to stay abreast of the happenings with the individual. Today in society, mental health care settings are in an institution, in the community, or within the home. Individuals have a right to autonomy. This means that healthcare professionals and nurses must respect the individual's decisions and the right to self-determination. The right to self-determination includes competency, informed consent, and commitment for psychiatric care. The right of self-determination is when an individual seeks out information about their condition, weighs the pros and cons of the treatment options, and select the options that best suit them. Because today's consumer's role has moved from being passive to active, the term client becomes more appropriate than the passively connotated term patient. Obtaining a legal informed consent in a mental health care setting is different from a medical surgical setting. It is often more complicated because of the nature of the mental health issues and the presenting symptoms. The individual's capacity to engage in the cognitive and affective aspects of the decision-making process may be impaired. There are obligations of a therapeutic partnership. For the nursing staff and other care providers, they need to accept the client as a patient that is capable of change. They need to be able to demonstrate respect and acceptance of the individual. They need to be able to empower the client and to educate the client. Nurses and other care providers need to make sure that they have the ability to provide privacy and educate the individual as needed related to the medical procedure or the disease process or illness that the individual has at the current time. In history, the care of psychiatric clients focused primarily on treatment. As the role of the nurse expands into more preventative treatments outside of the hospital setting, there are greater opportunities for nurses to be client advocates and apply the holistic model of care rather than just focusing on the medical model of care. There are reasons that individuals resist change. People become aware of problems and they're comfortable with what's happening. Change can bring about a level of discomfort. It can also disrupt the status quo. Individuals feel their self-interests are threatened, and they may have inadequate perceptions about the nature or the implications of change. Individuals may believe that the change will not be beneficial. What can nurses do to deal with change? The nurse can listen objectively to presented facts. They can acknowledge their resistance both subjectively and objectively. The nurse can talk to someone about their resistance and take their own personal responsibility. There are various mental signs and symptoms of HIV infection: agitation, apathy, confusion, decreased memory function, dementia, emotional changes, poor appetite, sleep disorders or disturbances, decreased or slowed thinking, tiredness or lethargy. Individuals with AIDS or HIV need to be treated early so that their central nervous system is not damaged. No one individual can keep up with all the new knowledge that is constantly being generated. Information overload is a state of mind in which so many facts have been absorbed that they all become unrelated jumble of information. Nurses need to maintain a positive outlook and an attitude, and remember to do their very best and strive to increase their knowledge and learn.